This is the Foot and Ankle Medical Group. I am Dr. Bruce Lerman. The following is a modification of the University of Pennsylvania Sports Medicine Center low-dye strap. The foot has already been prepped with pre-tape, tincture of benzoin. Sometimes good hairspray will be sufficient. The initial tape goes from the head of the first metatarsal around the heel. No tension on the heel. You got to make sure that's loose back there. And then finish at the base of the fifth metatarsal head. We're going to cover the entire bottom of the foot with U-straps going around the arch. I prefer the patient hold their foot in this position, dorsiflex the hallux, which plantar flexes the first metatarsal, increases the arch, and then go around the bottom of the foot, making sure, again, no tension on the bottom of the foot. Bring it around and then start covering the bottom of the foot with your tape. You'll be 3 or 4. The bigger the patient, the more tape you're going to use. This is 1 inch athletic tape. Again, very little, absolutely no wrinkles on the bottom especially. So we have the whole thing taped. I will never tape on the first metatarsal because this moves up and down, so we want to restrict motion. This is rigid on the lateral aspect of the foot, so we can bring the tape all the way up here. We go back to 1 inch, 2 inch tape now. Initially, it's best to cut the tape, put it on the foot, grab it, and push into the foot to make it tight. Again, cut the tape, put it, overlap 50%, push and lock it in. Follow it all the way up. Second layer, 50%, nice and smooth, no wrinkles. Third layer, linear strips going up and down, which will essentially clean up your taping job. And the patient is continuing to hold the toe in a good position, plantar flexing the first ray, improving her arch. Got 3 strips to cover from the bottom of the foot. If you want to make another layer, you would do the loops and then another layer. Put a little extra one on the inside of her foot since this patient has a very flexible flat foot. Finally, across the top, a 2-sided tape. So it will not stick to the top of the foot. I'm going to put this over the top of the foot. Load the forefoot with your finger to spread the forefoot apart. Splays the forefoot, leaves you about 1/8 of an inch of play. 1/4 of an inch of play. At the end of the procedure, use wax to smooth it down. You can use soap or wax to smooth down the tape. That is the low-dye strap. Thank you.